Thank you for staying tuned. Now, the priority of health workers should be put in the first place if we are to win the war against the coronavirus pandemic, but we are not seeing the government doing so. So tonight, we are talking to the chairman of the Kenya Union of Clinical Officers, Mr. Peterson Wachira. Thank you so much, Mr. Peterson Wachira, for joining us.
Thank you. Thank you for hosting me.
All right, first off, we start with the concern that we saw clinical officers move to the Senate, of course, to raise concerns that the government has remained silent on your welfare. Apart from that, during the Jamhuri Day celebrations, President Uhuru Kenyatta remained silent on the welfare of healthcare workers. What is your take concerning that?
Yeah, thank you. I think we have a problem as a country. And our problem is that we do not give priority to our health sector as we should actually do. I think this is apparent in the decisions that are made concerning the same sector. And I will start even from the budgeting. When we are doing the budgeting, I think we have an Abuja declaration where Kenya, as a part of the countries that signed it, um, agreed that every year they were going to set aside 15% of their budget to ensure that the health sector is well catered for. That is not happening. Coming to the crisis at hand, I think we have been out there since March, and we have expressed that there was need to ensure that we have adequate protection so that then medics can be able to get confidence to be able to treat Kenyans. This has not actually happened. So we also went before the Building Bridges initiative when the president said that he envisioned a constitutional moment, and we were very happy because we believed that it's only a constitutional change that would actually be able to get rid of the challenges that we are having in the health sector. And so we presented to the Building Bridges initiative, and we requested that we have Health Service Commission to be able to manage the human resources for health. So in the BBI one, it came out, but then in the BBI two, because of the push of the governors, it was removed by the BBI task force. So we were hoping that from this crisis, that at least the president would lead the country in looking at a permanent solution for the interruption of services from industrial unrest that we have had for the past 7 years, that we have been in devolution, when we have actually experienced a total number of 106 strike notices across the country.
All right. Now, we saw you as clinical officers move from Uhuru Park, demonstrate from Uhuru Park to the Ministry of Health offices. Did you receive an audience from the Ministry of Health, or what is CS for Health Mutahi Kagwe saying concerning these particular claims?
We didn't, and I haven't had him later address the same issue. But we have had some comments that are very unfortunate. I think he made yesterday and some other time in the past, where he's saying that actually we are insincere and that we actually do have enough protective gear. And so today we were there so that we could actually get from him where these PPEs are so that we can then get them so that our people are protected. You cannot be telling us that we have enough protection when we are seeing surging numbers of healthcare workers who are actually getting infected and even dying. So we didn't get any audience from the Ministry of Health, and we decided to go to Senate so that they can be able to intervene. We will also be going to the National Assembly so that they can be able to intervene, because we the people, we are the people with the power, and we delegate that power by electing these people to parliament. So they must be able to ask the questions on behalf of the 47 Kenyans who are the contributors of the tax that is being used for other things other than what should be the priority at the moment, and that is fighting this outbreak and ensuring that the soldiers on the ground and on the front line are actually protected and covered to ensure that the country can be able to actually overcome the scourge of COVID-19.
A sad situation it is, but therefore the question would be that 5 days ago, CS for Health Mutahi Kagwe said that KEMSA has been given the authority to release the PPAs. What is happening on the ground? Are we not seeing KEMSA sell the PPEs on a market price? Because KEMSA on one end is saying that they have not received the authorization, while CS Mutahi Kagwe before the National Assembly Committee said that he has given the authorization. What is not happening?
Actually, that's what we're actually wondering. That is the biggest question of the day. What is happening? Because I think what we are experiencing is pure rhetoric. Today they will tell you there is no money. Tomorrow they will tell you we have received, we have given orders for PPEs to be distributed to our health facilities across the country. The other day they will tell you that we understand the environment our medics are working under. And then the other day they will tell you that it's either you go back or we are going to sack you. I think we are dealing with a very confused government that is actually not able to put in priorities in line and even to focus on what needs to be done when, so that we can ensure that we coordinate together to ensure that our health workers are protected. And let me say this, sometimes people may think that we're actually doing politics, but if you saw the last message that Dr. Mogusu wrote advising his fellow colleagues that actually your salary and the money you are looking for is not bigger than your life, run for your life. If you look at the tale of the clinic officer, Victor Tioni from Nandi, that we have actually been fundraising for. And I want to thank all that have been able to fundraise. I want to thank the governor for Nandi and the Senator Cherarke from Nandi, who actually came through and they were able to contribute. And I think by now we have contributed around 2.5 million. So if you look at this, these are cases. These are very young doctor and clinic officer who have actually died. Victor Tioni has left two very young girls, two very young children, and a wife who is not actually even working. He has left a family that actually depended on him to be able to change their fortunes. So this is what we are dealing with as medics, and that is why when you see us come out and when we see the rhetoric, especially when it comes to protection of us on the front line, and we know that our people are dying, and that death does not only mean loss of that person, but it means that there is a child somewhere who has been condemned to destitution throughout their life because there is even no compensation when you die, then it's a very dire situation. And I don't really know if our leaders understand. And that is why we were actually taken aback. We were very surprised when the president, in his entire speech to the country during such an important national function, did not even see the need to be able to address such issues and show the country which direction we need to take so that in future we do not fall into the same trap. Right. It's a problem where we know the solution, but because we want to play politics with the health sector, then we do not want to implement the solution that we know will be able to solve this.
All right. Mr. Oshira, kindly put into perspective, apart from the issue of PPE, we have the issue of allowances. And recently, Dr. Mogusu, may his soul rest in peace, there were claims that he was not paid 5 months, although he was under the UHC program. And now, for the nurses and the clinical officers, they're in different cadres. There are those who are under the county government. There are those who are under the national government. Is the issue of not being given the risk allowance cutting across the national and the county government?
Thank you. It's very unfortunate, and it's not only the doctors under the UHC, also the clinical officers and the nurses and the laboratory officers and others who have been employed under the universal health coverage contracts have gone for 5 months and 6 months without salary. As if that is not even enough. We have a group of staff who are contracted in Vihiga County and given letters, and they have been working. They have not been paid for 15 months. even after a court gave a court order directing the county government of Vihiga to be able to pay. In Kirinyaga, the same is happening, and I think now for 13 months, we also have some health workers who actually have not been paid for that duration. Remember that when we do not get the PPEs and we are continuing to work, we cannot sit and say that we have not been given a PPE and so we are going to accept that we can get infected and die. We use our own resources to be able to procure the basic minimum PPE that we can actually be able to procure. But when you are not paid, how are you going to do that? And that is why we are actually asking for this risk allowance, because we have been using our own money to purchase this PPE. And when I say PPE, what I mean is the basic minimum that I should be having in a consultation room is an N95 mask that costs 750 shillings.
Yes.
So if I were to do that for the whole month, that will be something closer to around 25,000. Our risk allowance is 3,000 Kenya shillings. How will I then be able to purchase this? And then you're also supposed to have the eye protection in form of goggles and or a face shield, which is also not actually being provided. So I think if you combine now the non-payment and the lack of risk allowance and the lack of PPE, what it means is that this person cannot be in good health. And by good health, I mean both physically and mentally, because you are going to be under psychological stress, because you are under social stress because of not being paid, and you are going to be under anxiety. That lowers your immunity. You cannot be able to eat well because you don't have the money for that. So your immunity is going to go down. And then you are on the front line without a proper PPE. And that is why the infections are surging. That is why we are even seeing deaths of very young people without pre-existing diseases and people who should not actually be dying from this kind. So we are talking about a story of coordinated neglect by a government that tries to force the frontliners to work under very difficult and very risky conditions. And even when they fall sick, they do not provide a cover. And when they die, they do not compensate them.
All right. Now, what is the Council of Governors saying concerning this particular strike? We have seen clinical officers in Turkana County strike, the same situation in Bomet County. What has been the appeal of the chairperson of the Council of Governors, Wycliffe Oparanya, on the same?
I think what the chair of Council of Governors is saying, he's telling us that we should understand and that we should come and reason together. But he has never called us to the table to ask us what the problems are and what we think solutions could be. We have not also seen the same with the CS Health. Since the start of this pandemic, we have not seen the CS for Health call the union leadership on behalf of employees and tell them that we need to come to a round table and discuss how we can be able to work so that we ensure that you are protected as we also serve Kenyans. We have not seen that. But the question I think we are asking is, what are we actually supposed to understand? Because what I understand is that we have people who are not being paid for 5 months for over 1 year. Are we supposed to understand that we should stay without salary? I understand that we do not have the requisite PPE and that is why we are falling sick. So are we supposed to understand that we should work without the adequate PPE and then accept that we can continue getting infected and die? I don't understand. When they say we should understand, I really do not understand what they mean by that terminology and exactly what themselves believe the medics should actually be able to do, because they have the resources. It's only the goodwill that is lacking. You cannot tell us that it takes a number of billions to be able to give a policy direction to exempt the vulnerable health workers. We all know that if they're infected, they are going to die. It doesn't take a cent. It doesn't take a cent to also ensure that you take PPEs that are in KEMSA and ensure that you distribute them across the country. The issue of money they can discuss later. They are both government, the national and the county governments. They can balance the sheets later because they actually get the money from the exchequer, the counties, which is in the national government. But they should give these PPEs to the people who are supposed to actually be using them. And then when it comes to risk allowance, if we want to be given risk allowance in the manner in which we're asking both the clinic officers and nurses, we are not even going to take 5 billion in a year. We have 14 billion for BPI. We have more billions to even go and confirm signatures. We have more billions to do campaigns for BPI and so many other things that are important but are not as urgent. So we are saying there are things that are important and urgent, and that should be the first priority. Let us focus resources where we can be able to benefit, because even if you have a very good constitution, you have a very good BBI, are you going to lead people who are dead?
All right. Now, let's talk about the issue of medical cover. We have had clinical officers come out to say that the medical cover is only covering healthcare workers in public institutions only. But the CS for Health, Mutahi Kagwe, is saying a different narrative. What are we not saying concerning this particular issue of doctors, clinical officers and nurses' medical cover?
I think the other day, if you remember the CEO on NHIF, he said that the cover will only be covering the public hospitals. Those were not our words. It was from the CEO and HIF. So if there is a difference between the CEO and HIF and the CS, I think it's good for the government to be able to communicate so that they do not give conflicting information. But then the question I want to ask is, our colleague who died in St. Luke Hospital in Eldoret, which is a private hospital, why did they not pay for him if they are paying? They are going to pay for healthcare workers even in private hospitals. So I think it's evident that they are only going to cater for those in public facilities. And we know that you will not get an ICU bed there. And so you'll actually have you'll actually have to go to a private facility so that you can access that facility, and the NHIF is not going to pay for you. So we will have them to come back as medics and start these contributions, which I think is actually an embarrassment to a government that actually sends its soldiers out, and then you have to contribute for you to be able to get the services that you yourself was offering before you suffered the same.
All right. Thank you so much, Mr. Peterson Washira, for giving us quite a perspective on what is happening in terms of the plight of clinical officers. What can you tell us as your parting shot as we conclude this particular interview on health crisis here in the country?
My parting shot will be to His Excellency, the President of the Republic of Kenya. And I would like to say that, Mr. President, we know that you have a passion for health. We know that universal health coverage is one of your key agendas. There is a threat to universal health coverage. That threat lies in the mismanagement of the health human resources. We have a solution to that, and to ensure that UHC succeeds, let us have a health service commission, the same way we have other commissions to manage human resources in other critical sectors like the judiciary, like Teacher Service Commission, Parliamentary Service Commission, Police Service Commission, and with a commission that will be focused and non-political about the welfare of health workers, we are then not going to see these recurrent strikes, and we are also not going to see unfair labor practices by the employer like we are seeing in the illegal exploitative contracts, and with that we'll be able to assure Kenyans of the highest attainable standards of health, which is now the basis of the universal health coverage that you actually want to offer to this country. So we want to ask you, we want to pray that you can lead the country in providing a permanent solution, and those solutions will only come with the Health Service Commission.
All right. Thank you so much, Mr. Peterson Washira, for giving us a perspective concerning what is happening here in the country in terms of the plight of clinical officers. We do wish you all the best, and that the government and the Ministry of Health will look into your issues. All right.
Thank you. Thanks a lot.
We are taking a short break, but we'll be back in a moment. Do stay tuned.